Hey everybody, and welcome to another episode of Mind Matters, Navigating Head Injuries and Concussions. I'm your host, Kylie Como. I'm the legal nurse consultant here at Shane Smith Law, and today I'm back with our old friend Dr. Erik Reis from the Neural Connection. Dr. Reis is a board-certified functional neurologist and certified brain injury specialist with a doctorate in chiropractic medicine. He has completed extensive postgraduate training in neurological and nutritional rehabilitation for brain injuries and vestibular disorders. Dr. Reis serves as a clinical educator for Erconia, a leader in low-level laser therapy, and is director of health and wellness and co-founder at Nobody Studios, a high-velocity venture studio. Dr. Reis, as always, great to see you and have you on the show today.
Hey, Kylie, great to see you again as well. Thanks for having me.
Yeah, it's always fun to have you on. Hope our audience is looking forward to this one. Kind of want to reintroduce you, your practice, what you do. You know, functional neurology has been on the top of our topic list for a while now. We've had a few practitioners on, and our audience has seemed to respond to it quite well. So I really want to just kind of dive back into that and get into what integrative neurology and chiropractic medicine is and how those worlds meet. So, you know, many people don't associate chiropractic care with brain health, right? So how do you as a chiropractor and you kind of integrate those neurological therapies into your practice?
I think when you are trying to put the puzzle pieces together of the marriage between chiropractic and neurology, inherently when you look at what we've tried to do as a group of practitioners in the chiropractic space is we're really trying to help people improve their quality of life, right? And one of the ways to do that was classically associated as using soft tissue and manual therapies and manipulations. What we're finding out is that that's not just about, thumping a lump or adjusting a specific segment in the spine. There's actually a lot of neurology involved with that. And so when you provide an adjustment or a manipulation, you may hear a cavitation. There are structural things that go on with that, but there's also a lot of neurological things that go with that. And so the leaders in this space, the people who were looking into that, were saying, well, what else is actually going on behind the scenes? We realized it wasn't just a local thing like in the spinal cord or in the joint or in the muscle. There's actually a lot of feedback going to the brain. And so the evolution of thinking was, okay, well, if this is going on locally, what's going on distally? And what we're finding out, especially with some of the really interesting work being done with like Heidi Havoc over in New Zealand and Australia, is that manual therapies and many manipulations can actually change central processing in the brain. Now, I'm not saying that I can inherently always automatically, without a doubt, cause a beneficial change in the brain, but something else is going on. And so as you start kind of going down that rabbit hole, it's like, well, gosh, there's so much neurological real estate here that we want to have and understand. And so that's really where functional neurology kind of came into the play, is saying, listen, we know that the brain controls everything, right? So I always tell patients, go have a conversation with a cadaver. You're not going to get very far, right? It's got all the muscles, all the joints, all the tissues, all the organs. And what I mean by that is that the brain really does control everything. So if we can understand the brain and how the brain processes information, there might be a way for us to actually help patients update their software, metaphorically speaking. Functional neurology is a way of looking at the nervous systems to say, instead of us having this kind of black and white, you're either sick or you're not, you got a diagnosis or you don't, you've got a brain bleed or you don't. What we're looking at now in functional neurology is saying, well, everything's kind of always on a spectrum. The brain's always changing, the body's always changing, our inflammatory status is always changing. What can we do to start nudging those factors in a beneficial, functional way to help people improve their functional way of living their life, right? So we still abide by the core principles of neuroscience. We still train with the Bibles of neurology, which is like the Kandel and Schwartz, the Susan Herdman vestibular disorders books. I mean, all of these things are really important for understanding the brain and how to improve brain function. Where we kind of change and take a different path is that if a traditional Western medical neurologist uses surgery and medications for their treatments, we use rehabilitation, visual and vestibular therapy, cognitive behavioral therapies, passive and non-invasive modalities, and even manual therapies to try and achieve similar results. And we believe in some capacity that maybe we can be a little bit more precise with our treatments, because we know that with medications, they're going to go systemically, whereas with our treatments, theoretically speaking, you can kind of have a bit more of a bias. So it's kind of a unique evolution starting from where chiropractic started, but more importantly now putting it together with brain health and central neurology.
Fascinating. I think functional neurology, before I came into this role, I'll admit I was unaware of the depths to which that field has reached. So always fascinated to talk with practitioners like yourself. It's not really a new area. It's just kind of, people are just starting to become more and more aware of it as we're tapping into the brain, as you mentioned, a lot of that brain body connection and how that really works. So along with, being, I hate to say it again, somewhat of a newer field, surely there are a lot of misconceptions that you might come across about functional neurology and these integrative approaches to brain injuries. Could you kind of speak to some of those?
Yeah, I think a couple of things. One, I think it's really important for people to understand that not all practitioners or providers are created equally, right? So just because you call yourself a functional neurologist doesn't necessarily mean that you always know what you're doing. I think it's important for people to have board designations and make sure that they're actually licensed and, they actually are supporting with evidence data and having governance over their ability to actually say what they're doing. But then more importantly too, once you kind of bypass that, not all providers, even who are licensed, are created equally. I think it's really important for patients to, meet with their doctors, but I've said this before and I'll say it again. The most important component is that your provider is looking out for you and your provider is teaching you. They're educating you. They're empowering you. They're giving you the kind of independence that every patient really is looking for, which is to educate and then more importantly, show you, hopefully, how to live your life. Most patients that come to our office will hear me say once, if not multiple times, my goal in the most loving way possible is to kick you out of my office so you can go live your life. Like I'm cool, but I'm not that cool, right? Like I don't want you spending any more time in my clinic than you need to. And what I mean by that is I'm not abandoning patients for the sake of just saying, get out of here. What I mean by that is my goal is to really give them their life back and to educate them so that they know how to take care of themselves. I'll always be there for them clinically. But I don't think that that's what healthcare should be. We shouldn't be dependent on a system. We shouldn't be dependent on seeing somebody 3 times a week for the rest of their life. People should be able to go out and do things. And there's a time and a place for maintenance. I won't, poo-poo on that. But I'm really, really focused right now on trying to help patients educate themselves and give their lives back, especially with the populations that we see with, chronic migraine, vertigo, dizziness, even brain injuries. I have so many patients that I've seen even over the last week where they've just kind of been left by themselves. They haven't been educated. They've been to the big major institutions and no one's told them or taught them things. So they're kind of just left on their own accord. And so we really pride ourselves at the Neural Connection of making sure we have patient education at the forefront. And then more importantly too, we get results.
Yeah. I think anybody that's watched any of these episodes before and seen you and I have conversations, education and empowerment, I know, is a big part of what you and your team do at the Neural Connection. You do have people coming into your office with complex neurological, complaints. From our perspective as a law firm, we deal with a lot of motor vehicle accidents, people who have injured their heads in many ways, not of their own accord, of course, and they have these complicated symptoms that I'm not trying to throw anybody under the bus, but it's difficult for traditional medicine to treat their primary care, even neurologists who aren't necessarily trained in these types of injuries. It's very frustrating, and we hear that. And so when we find people like you, practitioners like you, it's a godsend. If I'm coming to you with this brain injury, this mild traumatic brain injury from a car accident, and I've got all these complaints, migraines, you listed vertigo, etc., how do you start to formalize a game plan to get me better?
When people come to our office who are asking those questions to get the answers they're looking for, the first thing we do is we always do a consultation. And I can't tell you how often I do a consultation, and I've told people, I don't think we're a fit. I think you may need to go get an MRI. Maybe you need to get an examination with a medical neurologist if you haven't had one. Maybe you need like a neuropsych evaluation before you come see us. A lot of times the consultation really is an opportunity for me to figure out if they're even a fit for the office and if I think I can help them. And I will always be honest with patients and whether or not I think I'm their fit, right? So if I think I can help you, I'll be honest and tell you if I think I can. If I can't, then I'll send you somewhere else. And I think that ethos has really helped us not only grow our practice, but our awareness as well, because people are now calling us just because they know we're going to give them an honest answer and give them, maybe a true North Star for them to go follow, right? So that's always the first step. The second step then is essentially getting them in for an exam. I mean, that's really, at the end of the day, the best way for me to understand what's actually going on with somebody. I can paint theoreticals all day, I can cite references and peer-reviewed literature, but I just really don't know what that patient needs until I actually can get them in for an examination. I can run diagnostics, I can do a bedside, I can really see what's going on with them. And then at that point, it's the same conversation. Do I have conviction that I can actually help them? If I do, great. That's a conversation that we have and we discuss what treatment looks like. If I don't think that they're a fit and they need to go see somebody else, or if they're a vet and they have VA services and I'm like, hey, let's get you in touch with somebody at the VA to get this covered for you so you can get the care you need, then we make those moves and we have that conversation. So it's really all about being patient-centric. I view myself as kind of being somebody along that hero's journey who can help guide them and support them along that. But at the end of the day, the patient really is the center of everything we do in the clinic.
Yeah, I agree. I mean, in our past conversations, that theme continues to come up. You're somewhat of a we call a brain injury Sherpa, if you will, and you're not afraid to find others to help, or you're not too proud to collaborate, with that interdisciplinary team. You don't try to micromanage every little bit. You kind of know where they need to go, and I really appreciate about you and your team. I know you and I have talked about nutrition and supplementation. You've even gotten into the order of the foods in which we eat and how that can impact not only our recovery but preventatively, to make our brains able to absorb those types of injuries more easily. Can you touch on some of that?
Yeah, so Kylie's mentioning something specifically we talked about maybe 1 or 2 episodes ago. There is some data showing that it's not just the foods that you eat, but it's actually the steps in the order of the foods that you actually eat them in the sequence. And we're specifically talking about GLP-1. So GLP-1 is this peptide. A lot of people are taking it for weight loss. Hopefully this isn't new news for anybody, but you actually genuinely produce GLP-1 inside your intestinal tract. What they've done from a pharmaceutical standpoint is they've made it have a longer life inside your body to have that action where it's going to suppress your appetite, have feedback to your hypothalamus, and hopefully allow you to lose weight and not eat as much as you used to. So what we were talking about was the sequence of foods that you eat will actually have a consequence of how much GLP-1 you organically produce. What we were mentioning was eating fiber first, followed by then proteins and fats, and then lastly, eating carbohydrates. There's studies that are alluding to and showing that you can produce higher levels of GLP in your intestinal tract and in your brain and body that will have those beneficial effects than if you would have eaten that same amount of food in a different sequence. And most of us inherently, unfortunately, instead of going for the salad and the vegetables first, we always go for like the sweets, the chocolate, the pasta, things like that. And so while yes, eating less is more, and there's the laws of thermodynamics with like caloric consumption and caloric usage, that's a really important factor for us. But on like a more grand scheme of things, and not so much nuanced, is just the fact that nutrition really is the foundation for brain health and body health. I mean, we know now in interesting studies that are going on, Mayo was kind of leading this for a while with fecal transplants. Okay, so rats who were inherently dealing with anxiety, they would transplant fecal matter from rats that had anxiety into rats that didn't have anxiety. And those rats that didn't have anxiety before would now show anxiety-based tendencies because of that. So the question was, well, what's going on? I mean, the brains are still the same theoretically. What we're finding is that the gut microbiome and the bacterial, these trillions of colonies that inoculate our intestinal tract, have a role to play, not only in our digestion, but in the production of neurotransmitters and how our brains function. And so your nutrition really serves as the fuel to feeding those bugs that live inside your intestinal tract. Some of the latest numbers, and these are all estimates, but the latest numbers are kind of suggesting that for every 1 cell you have in your body, you have up to 10 different types of bacterial cells living in your intestinal tract. So as much as you think you're a human, you're far more bacteria than you are human, right? Which is an interesting kind of thought process within itself. But the foods that you eat are essentially broken down by these bugs and bacteria in your intestinal tract. And then they produce these factors, these postbiotics that we would call them in the literature, that your brain and body will absorb and essentially use for fuel or to dampen inflammation or to modify your immune system. There's an array of factors that go into that. And so nutrition is just an essential element for this. I think for a long time, we kind of split the mind, body, or the gut, brain factors, and now we know they're just so intimately tied. So nutrition is an essential factor, and with 90% of the patients that come into my office, I have to have that conversation with them about nutrition because one, most of them think they have a good diet when maybe they don't, but then two, a lot of them know they don't have a good diet, and they're like, listen, I'm open to taking steps trying to figure out how to solve this problem. So nutrition to me is just a fundamental factor with brain health because we know so much more about the brain and how that interacts with the gut.
Does it have to be expensive to eat well in these types of cases? No, that's a big
No.
concern of a lot of clients and patients.
Yeah, and I think it is because so many people say that you have to take this supplement or you have to do this protocol or you got to be keto, you got to be, paleo, you got to be carnivore. And that's just really not true. I mean, the best source of your nutrition will always come from food. My wife works for Aldi. We're such massive fans of Aldi because they have organic food sections. They have relatively cheap groceries. They've come such a long way from the decades ago where I was looking at an Aldi when I was in college and like, okay, things, I may not want to go shop here, but they've evolved so fast and so quickly with the way they've done things. And that's one of the cheapest groceries in the US right now. They're one of the fastest growing grocers in the US as well too. And so eating well doesn't have to be expensive. If you take a look at how much people will spend on like fast food or eating out, I mean, you can get the same equivalent of food by shopping healthy. And also you're going to get far more nutrients. You're going to get a lot more fiber, which is one of the biggest factors for longevity, quality of life, anti-inflammatory, and even cardiovascular disease. So eating healthy does not have to be expensive, and you don't have to go to Whole Foods to get your nutrition. You can get that in the grocery section of any grocery store, right? It's just you kind of have to know what you're looking for, and you have to be willing to change your habits. And I think that is one of the hardest parts for a lot of people is your identity in some fashion, way, shape, or form is kind of correlated and tied to your habits. And so you kind of have to challenge that identity, but you have to change your habits as well. And cooking food at home sounds really intimidating, but it doesn't have to be. You can find 5, 10, 15 staples that you like, and you can go with that, and you can be relatively safe with that. So I'm always trying to challenge that. We use supplements in the office when I think it makes sense, but you can't out-supplement your way out of a really poor diet, and you never will be able to.
I'm so glad you added that piece right at the very end. Yeah, supplements are great, but it doesn't replace good nutrition. So 100%, 100%. Thank you for that. Always fascinating when we get to talk about food and how it impacts the brain. Dr. Reis, you've put in countless hours treating, traumatic brain injuries, concussions, vestibular disorders, all of that. Are there any particular, let's say, advances or approaches that may have made more noticeable impact for your own patients, recently or otherwise?
I think in my opinion, as I've evolved throughout my career, I'm at, 12, almost 13 years into this now. I think one of the biggest things that I brought to the table and realized is that every section of healthcare has advantages and disadvantages. Once you kind of step outside of your own lane and you realize that there are other areas of healthcare that do things really well, then you can kind of pull and adapt those therapies, those techniques, those tools and bring them in-house. And so one of the, kind of sayings I have is you can't build a house with just a hammer. If I was treating traumatic brain injuries, concussions, migraines, and I only had chiropractic-based techniques, I might be missing out on opportunities to help my patients. That's why we do things, and that's why I love neurology, is that it's not a technique, it's really a philosophy, and it's a critical thought process to understand how I can use different tools in different fashions, right? And so much like building a house, we use different tools, we have different contractors and people coming in to do that. It's kind of the same thing for helping people structurally, neurologically, and metabolically. So I've taken and adapted things from nutrition, functional medicine, different dietary, techniques and protocols. We use a lot of visual and vestibular and ocular types of treatments and therapies in the office because we have to. I'm really interested right now in like cognitive behavioral therapy and how these factors play a role with just helping people shift their mindsets, their habits, and their beliefs. I love James Clear's work on habits and what he's been able to do with helping people start shifting their, psychological and emotional settings to start taking steps towards being a better version of themselves. We really have to adapt. And so when I see patients coming in, and regardless of their diagnosis, I'm like, listen, what aspect of the Rubik's Cube do I need to put together today? Because I think in healthcare, it's kind of fragmented, right? So Kylie, you come in and you just had a bad car accident and you've got neck pain, so you go see a chiro or you go see a PT. Okay, great. Well, you're also a little bit dizzy and you kind of feel like some brain fog, so you go see an EENT and you want to get that checked out because you got those symptoms. And all of a sudden you're like, gosh, like my gut just feels out of whack and I don't know what happened, but like I'm eating the same foods and I feel off. So you go see a gastroenterologist. And then you're like, okay, well, my sleep is just gone downhill too. So you go see a sleep doctor. And it's like every single person is working on their own side of the Rubik's Cube. But in the same fashion, they could be messing up other people because they don't know what they're also working on. But no one's really looking at you from an integrative perspective. That has been something that I've been really bullish on over the last 5 years of my career because I've just seen so many people fall through the cracks. And I've realized that once we start really having discussions across the aisle, but also start thinking along those lines of how do we work in an integrative fashion, patients get better. And I don't think I'm the only person that can ever fix somebody, and I never will. But what I'm really keen on is challenging that narrative and trying to cross that chasm to talk to other doctors, learn more about them, send patients back and forth, but then open those discussions on the benefit of the patient. And that takes a lot more time, a lot more resources. But I've seen the outcomes drastically justify the means.
The one last thing before I know we have to end, I know we're right out of time, but I know you have a particular passion for growing businesses, not just the Neural Connection, but I know you've got your hands in many business startups. So as a health practitioner and as a leader in business, what kind of unmet digital or integrative health needs are you really passionate about right now? And what do you see coming down the pike for you and your field?
I think the future of healthcare is going to be focused on personalization and optimization. And then what I mean by that is if you take a look at like even smartwatches and wearables, what is this data actually giving us? Yeah, it's giving you your heart rate and maybe it's going to tell you about your sleep. It'll tell you about your calories, but how does that help Kylie? How does that help Erik actually understand like where we are, but where we actually need to go or want to go? Are there ways to start integrating different AI principles to say, okay, Kylie, you want to train for a marathon, but Erik, I just want to get out of bed in the morning without back pain. Those are two very different outcomes, but can we use data and information that was being collected to actually help empower us and motivate us to actually be able to make the changes that we're looking for? And this is really where I've seen a lot of the benefits, but also the downsides of being in practice. I can only help one patient at one time when I'm with them. Scaling healthcare inherently is going to have to involve technology. Now, that doesn't mean that we have to spend more money on doing that. It doesn't mean that we have to, really, change the entire system. What I think is going to mean at some point is that people are going to take their health into their own hands. And at some point, Kylie and Erik are going to have their own healthcare coach, healthcare provider, someone who's going to motivate them, but also to help keep them honest. And I would love to see some interoperability of sharing of data. Now, the new legislation here coming out is talking about, can you scan a QR code and every doctor has access to your data? I'm a little hesitant on that because I just still don't know if there's actually the safeguards in place to protect your patient privacy. But if there's things like using on-chain, like, crypto-based or ledger-based, technologies to put that on there to say, Kylie, you're going to go see your dentist scans something and now they get a fraction of your health data, the only thing that's relevant for you, but you're always in the driver's seat and you can always protect it. I think that that's interesting. And those are some of the things that I'm really keen on exploring is what can we do to help patients live healthier? What can we do to help streamline their access to services, especially in rural areas? Not everybody lives in the center of a city. And then more importantly, what can we do to help them live a better life? And I think technology and where we're at right now with AI and just how we're challenging the narrative is such a great time to be able to build these companies. It's going to take a lot of hard work. There's going to inherently be failures, but I'm really bullish on trying to find those ways because where we're at now, we're just not trending in the right direction. And if we continue down this path, I'm really worried about where we're going to end up because it costs way more to get access to healthcare in the US. Our sudden infant death rates are still higher than most countries that are developed throughout the world. And our patient access is still very poor and very limited. And so we have a lot of work to do. And that involves us challenging our narratives and beliefs. So, like I said, I'm not the smartest person in the room in these discussions. I'm passionate about it, obviously. I just always want to keep the patient at the center of all this. And it doesn't matter how much tech we design or build. If it's not helping people live healthier, then I don't think it's going to do it justice.
Wow, what a great way to wrap up our discussion today. Certainly, the passion you spoke about is coming through, and you definitely make a case for an exciting horizon coming toward us for what the future of healthcare could look like, especially if we have champions like you at the forefront trying to push it there. So, thank you for that, Dr. Reis.
Yeah, thanks, Kyle. I appreciate you guys having me on, and it's always a pleasure joining with you.
Well, that's going to do it for another episode of Mind Matters, Navigating Head Injuries and Concussions. Again, I'd like to extend our gratitude to Dr. Erik Reis for joining us today and sharing his expansive knowledge and expertise with us. Please look for him and his team at the Neural Connection in Minneapolis, Minnesota area, or virtually at their website, theneuralconnection.com. I hope that our audience has enjoyed listening in on this fun and discussion and is coming away with a deeper understanding of the intersection of integrative neurology and the care and treatment of brain injury. Please don't forget to hit that like button, subscribe to our channel, and keep up with our latest content. Leave us a comment and let us know what you thought of our discussion today. And as always, remember, if you're in pain, call Shane at 980-999-9999. Thanks for listening.
In pain, so I call Shane. 980-999-9999. In pain, call Shane.